So what I find quite fascinating about the mushrooms is that there is a lot of evidence-based clinical trials now that have been done on these mushrooms. If you went into Google Scholar or PubMed, you would find 15, 20,000 papers on these medicinal mushrooms. Of course, you have some mushrooms that are a little bit more well-known than others, such as reishi or Lionsmane, that has become very trendy in the whole neuroscience arena because of its effect on cognitive function with Lionsmane. But you have so many other medicinal mushrooms that are very powerful when it comes to boosting the immune system, or modulating, rather, as we call them, modulating the immune system. And this is one of the reasons earlier when these mushrooms were discovered, specifically, I think it was shiitake, but the person that discovered some of the medicinal properties of shiitake decided to coin these molecules as biological response modifiers, meaning these specific molecules in these mushrooms, namely the beta-glucans in them, have immune modulating properties, which for me is quite interesting, because when you look at the Th1, Th2 response in the human body, if it's skewed more towards one way, we end up with, cancer markers. If it's skewed on the other way, then we're looking at autoimmune conditions cropping up. But when you're looking to balance the Th1, Th2 immunity, then the mushrooms play a very big role in doing that. So it's not like medication that will have one specific effect. It will actually work with the person's body to modulate whatever inflammation is happening within that person's specific, internal makeup. So for me, that's quite fascinating, learning about this new evidence-based research papers coming out on these medicinal mushrooms.
Yeah, and from my end, being a Chinese, we hear Cordyceps is like a big thing for us, and there's a lot of research on that, isn't there?
There is a lot of research on Cordyceps. In fact, recently I'd seen a very interesting paper with Cordyceps having a neuroprotective activity in the brain, mainly because of its effect of increasing oxygen uptake in the in the brain pathways as well. So that specific paper was showing the anti-inflammatory effects of Cordyceps. And another interesting thing about Cordyceps is that it contains cordycepin and cordycepic acid, which are responsible for this ability of that mushroom to increase oxygen and to reduce fatigue and tiredness in people experiencing that, which is the main kind of feature that Cordyceps is well known for, increasing energy.
That's right. Potency.
Potency. Also potency.
So I mean, that's why it's highly prized in terms of energy.
Absolutely. In fact, I heard that in China, it's weighed in the same way as, it's compared to gold standards when it comes to giving someone Cordyceps as a gift. This is what I heard.
It is indeed. Mushrooms have I think we eat a lot of mushrooms in the Chinese culture, and each one is supposed to have different properties, because diet's really important in terms of traditional Chinese medicine. And the way I was just giving a talk to medical students on acupuncture, because I do that in practice, and we talk to the university a couple of times a year. We get students in, and I was telling them, a friend of mine who's a dermatologist, actually, but his family do traditional Chinese medicine, and they've done for generations. The way he explains traditional Chinese medicine is that this is the largest cohort study of all time. If things have worked, we've kept them. If things haven't worked, they've sort of died away. And suddenly mushrooms and things like Cordyceps have stood the test of time.
They have. It's interesting that you say that, because when you look at Cordyceps, for example, recently a lot of the athletes have even used it in sports endurance because of this potency, as you said, and its ability to increase oxygen uptake in the cells. And it's been shown to actually improve endurance in athletes. But actually, I've used it quite a lot in my clinical practice for patients that have chronic fatigue syndrome or energy problems or just general fatigue. And recently, there's even been a paper on its antiviral properties. So again, if you're looking at people with viruses, then you're looking to help them A, recover from it, but B, increase that energy when every time we're experiencing an immune dysfunction. Fatigue is one of the first symptoms that clients are experiencing, and Cordyceps is one of the first go-tos that I use, just to bring back that energy in the client and for them to be able to fight off anything that they're experiencing. So quite an interesting one with Cordyceps, absolutely.
And what I'm also interested in is the immune modulating effects of mushrooms, among other things. But mushrooms for a long time we've known that can affect the immune system quite potently, really. And so I'm always interested in things which can support the immune system. And I think that has a part to play in people's therapy against almost anything.
Absolutely. I mean, when you say about mushrooms being immune modulating or having this potent effect on the immune system, yes, IL-2 is one of the interleukin-2 is one of these cells that have that ability to be boosted by mushrooms. But actually, there are a host of other innate and adaptive immune cells that have a very potent effect when they're exposed to the mushroom receptor site in that sense. So mainly it's the beta glucans within these mushrooms that have the immune modulating, or in cancer patients, as you say, immune boosting effects. And we're not just looking at the IL-2, we're looking at natural killer cells, we're looking at macrophages, we're looking at dendritic cells that trigger adaptive immune cells such as T and B cells to then get stimulated in the body. So for me, it's been quite interesting to see that every mushroom or every type of beta glucan within a mushroom has a different role or has a different stimulation process within our immune cells. So if you looked at maitake, for example, and you gave me the example of your friend where the cancer may have spread. Maitake is one of those medicinal mushrooms that have the highest amount of beta glucans that have been shown to stop the spread of the cancer in other organ areas. So really to stop that metastasizing from occurring. And I've seen this quite a lot with patients using integrative treatments. So using, the conventional treatments of chemotherapy or radiotherapy together in combination with maitake has shown to really reduce the spreading of that cancer. So it's very interesting to see the role these medicinal mushrooms have to play with the immune system. You have mushrooms like the reishi that don't just contain the beta glucans, as I said, but they also contain other anti-inflammatory molecules such as triterpenes that also have a role to play to modulate the immune system. So it's really fascinating to look at every single mushroom and their role in the immune system. And what I've seen is when you take a combination of these mushrooms, actually the impact on the immune system is even greater because each one is having a specific effect on a specific immune cell. So taking them in conjunction, let's say if we were to take reishi and maitake together, their overall outcome would be more powerful than taking these mushrooms individually.
And are there trials to say that?
There are many trials to say that. There are many papers that have shown that mushrooms have this synergistic approach when it comes to being used in conjunction. And I think even in traditional Chinese medicine, that's what they do. They use some of these mushrooms as a blend versus just taking one individual mushroom.
Yeah. So what are the outcome measures that we were looking at? I know the Lionsmane. Should we talk about Lionsmane for a while?
Yes.
Because one of the things David and I at the conference quite like do, in our time we're both GPs, but we have an interest in healthy lifespan. So health span, the term is living a bit longer with healthy years. And one of the areas of research in age will get you in through one of three ways. They reckon 80% of us will die of cardiovascular disease, heart attacks or strokes, cancer or dementia. And we think there's enough data now to suggest that we can push these at least 5 years, or about 5 years realistically, into the future. And you think 5 years isn't very long when you're 20 or when you're 30. I can tell you, as you get older, 5 years is a long time. And when you think about your parents, you think, oh, they start getting infirm at maybe 75, 70. What if they didn't get infirm at 75? They start getting ill at maybe 80. Maybe if they didn't get demented at 80, maybe got demented at 85. That's a long time. That's a long time. So I think these things are really important. And one of the things that we know is you really need to approach this, say dementia. Unfortunately, my family, there's dementia in the family, and the question is, if you did genetic tests, and you can do these with 23andMe and things like that, if you have the ApoA4 lipoprotein gene, then you're maybe 15 times more likely to get dementia. It doesn't guarantee you will get dementia, but you're more likely to. And if you have this gene, or if you have one of the variants of this gene, which might mean you've got 3 to 4 times the risk rather than 15 times the risk, you probably want to be acting early just in case. But you can't just wait till you've got memory loss. You've got to start doing it maybe 15 years, 20 years beforehand.
It's a very interesting topic when you're looking at dementia, Dr. Wong, definitely, because you're right. Most people are going to be, at the end of life is going to be, like you said, it's either going to be cancer or stroke or dementia, which is a huge thing that I'm seeing and experiencing a lot in clinical practice with a lot of elderly patients. And this is one of the reasons we've looked very closely at Lionsmane, which, as I was saying earlier, it's trending in the whole nootropic industry. It's become a big thing. And it's not just a myth, but it really is true that there are specific molecules inside Lionsmane that have the ability to stimulate nerve regeneration, which I find quite fascinating. So it's got something called...
And the studies weren't in young people; they were in older people as well. So that's really interesting, isn't it?
It is, and I have one anecdotal actually experience of an elderly woman, 79 years old, and she was experiencing intermediate stages of dementia, losing her memory and not being able to recognize family members, etc. And I did put her on a 4-month protocol of Lionsmane extracts. And I did see, after 4 months, that there was some improvements, because the nerve, wherever the myelin sheath may have been damaged, somehow there was there was some kind of repair to that damage that was being made to the myelin sheath when it comes to dementia. And immediately her family members called me after a couple of months and said, it's really strange, but she's been recognizing us. She's been calling out our names. And this is something she hasn't done in a year since her advanced dementia symptoms. So I can see that definitely when you're using Lionsmane, and especially the ability for it to stimulate nerve growth factor, I am seeing an improvement in patients. But absolutely right, what you just said before. It's not just about, okay, let's do some damage control and take it when the dementia is set in, but really for people who might have a genetic predisposition, as you said, with these DNA tests that have come out, maybe it's a good idea to start taking Lionsmane now instead of waiting for the first symptoms to kick in. Absolutely.
Yeah. And I think, we've reached a generation where we're more aware, we've got enough information, and maybe even more proactive to be able to, if we are able to give us this extra bit of a healthy life, if we can.
Absolutely.
But that's a wonderful story. So you say you think how it works is what does it show remyelination? Is that the case? Or?
Some of the studies have shown remyelination. But most of the studies have shown the nerve, the ability to grow new nerves, so nerve regeneration.
Yeah,
Those have been better. But really, the combination, if I talk on a nutritional perspective, wasn't just the remyelination, wasn't just the mushrooms, but there were other things nutritionally that were being considered, such as including coconut oil in the diet and other things. But that was the overall improvement that we were seeing.
Because classically, I can see regrowth giving memory, but classically, demyelination affects MS. That's the thing. I wonder if there's any. I'll look it up and see if there's any data on Lionsmane and MS.
Absolutely, I think that would be interesting. I mean, I'm constantly researching it for memory, cognitive focus, using it for dementia as well. We are seeing improvements when being taken for at least 4 months.
But certainly, supplementation, it's all about supplementation. It's just adding something on to what you're already doing, in addition to living life healthily with the right type of exercise, the right type of diet. As you are a nutritionist, I'm sure you don't even have to say. I think the last time we talked, it was a lot about what you do in nutrition, how important it is.
Yes. And it's truly a 360 approach, Dr. Wong. You're right. It's not just supplementation, it's lifestyle, it's diet, it's exercise, and
social contact, what you do to increase
social contact, the ability to cope with stressful situations, and for you to be able to keep a very calm mind. All of this helps with reducing of aging, not just physical aging, but the aging of the brain, as you well said.
So Romina, I never really got to ask you, how did you get interested in all this?
In the world of nutrition, or in mushrooms? I remember I was at this conference, and I found this first book that was called The 12 Medicinal Mushrooms, or the Introduction to Medicinal Mushrooms. And I remember I realized that that in our nutrition degree, we had not spoken much about it, but I had seen so many studies around mushrooms and cancer. I'd seen so many studies around mushrooms and autoimmune conditions that I got quite intrigued by their ability to have an impact on so many different body systems. And this is where my interest started growing. And I started studying mycotherapy, which is the study of which is looking at the healing effect of mushrooms on health. So it was quite an experience. And I think the book was by Martin Powell, if I can remember correctly, who had this little booklet, and then he had subsequent books on his work around medicinal mushrooms. So that started getting me quite interested, because I said, if I haven't heard about it, no one's heard about it. And certainly the general public haven't heard about it. So what I find interesting, Dr. Wong, is that it does come from traditional Chinese medicine. It comes from the Far East, but up until now, there weren't enough, Western kind of traditional evidence-based information about it. But they have been used for millennials in traditional Chinese medicine. And certainly, again, anecdotally, I know that they must have seen amazing results using these mushrooms. And this is why it became a very common practice back in the Far East. And finally, it's come to the West. So for me, it's a big win that we as practitioners, as healthcare professionals, we can zoom more into looking at these studies around these mushrooms.
Wonderful. And you think, so you talk about them being modulators, immune modulators. Do they have any neuromodulating effect?
They do have a neuromodulating effect because, again, when I was talking about Cordyceps, the fact that Cordyceps has the ability to have a neuroprotective function is not because of anything else, but its ability to stop ischemia in the brain, or allow oxygen to enter into the brain. So there's definitely a neuroprotective ability that Cordyceps has, for example. And I will be sending you the study for that because I found it quite interesting to read up on Cordyceps and its effect on the brain.
Wonderful. Oh, thanks so much for agreeing to contribute to the conference. I, wish we could also include you as one of our lineups of speakers, but you'll be on the lineup of other talks that people will get. I'm sure it'd be so interested in, and I'm going to put this on YouTube so that everyone can get hold of it and hopefully pique some interest, because you organize the Nutrition Collective, don't you? Can you tell me a bit about that?
So the Nutrition Collective is literally a collective where we get experts from around the world to talk to us about chronic disease. So whether you're interested in immunity, in cancer, in brain health or gut health, we get experts, renowned experts from the world who have 20, 30, 40 years of experience, and we bring them to you so that we can educate healthcare professionals in the areas of interest that they may have. And I love the tagline because it took me a long time to create it, but it's all about healing chronic disease with insights from experts and leaders in nutrition. This is really what we're all about at the Nutrition Collective. We're trying to create a community of healthcare professionals that are interested in integrative medicine and finding integrative ways of supporting chronic conditions that we're experiencing today. And I really loved what you said, Dr. Wong, that there are 4 main diseases that we're looking at that are going to come into our clinical practice, whether we like it or not, because of all the different issues we're experiencing in this world, which is, as you said, cardiovascular issues, dementia. You talked about strokes, which is also a very big thing that's happening in the world, and cancer. And these are the topics that we're covering to support healthcare professionals and practitioners from around the world to get more education, more knowledge, and more cutting edge information around these types of diseases.
And immune modulation is so important, as we learned in the last couple of years with COVID. And I think medication has only brought us so far. Great that we've got the vaccines. I was involved with the rollout, and we've done a great job. But I think when you catch it, all we can do is help support our immune system as best as we can to allow it.
Absolutely. And there's such wonderful studies that have come out with the mushrooms. There have been beautiful studies on shiitake and cordyceps having a role to play in having antiviral properties when we're looking to support the immune system. So there's so many natural things out there that we need to look after, as you said, and to continue to support and modulate our immune system.